A strong, robust primary healthcare system was the overwhelming priority for the Ministry of Health in 2012. But secondary and tertiary healthcare were not to be ignored or undermined.
A strong and effective primary healthcare service will go a far way in restoring public confidence and trust in the public health sector.
And even as policy changes were contemplated and routine tasks executed, the ministry was called to action as public health challenges arose.
I'm on the mission. A mission. Today is the day. Start your ignition. Let's take it away. We gotta ride.
The reins of government changed hands in December 2011, and when Prime Minister Portia Simpson Miller named her cabinet in January, Dr. Fenton Ferguson was appointed the new Minister of Health. He got down to business right away. One of the first items on his agenda was the no user fee policy that had been in effect since 2007.
I want to make one thing absolutely clear. This government supports the removal of user fees from social services for certain segment of the population.
He said the new administration would implement a new policy, a shift from universal free primary, secondary and tertiary health care to free health care at primary care facilities only, but protection would continue for the most vulnerable at all levels of the system.
We have completed the terms of reference for consultancy to determine the necessary measures that must be in place for the implementation, which will focus on an effective waiver system to determine persons' eligibility to pay.
The opening of that $6.5 million ambulatory chemotherapy unit in November in the former Charles Moss ward at the Kingston Public Hospital was one of the more tangible results of a determination to improve local capacity to treat cancer. To ground that and other developments, work advanced on a national cancer treatment plan.
This new government does not intend to give up in the treatment of those suffering from cancer because of an absence of treatment facilities in the public sector.
Another important policy planning initiative that advanced in 2012 was the move to introduce an electronic records system to improve records management at health facilities.
It is an area of weakness.
In July, Dr. Ferguson announced that the ministry had secured funding from the World Bank to strengthen and modernize the National Health Information System over a 6-month period from July to December 2012. An equipment performance task force was established last year to standardize the procedure for procuring and maintaining health equipment. This was supported by an arrangement with the Cuban government for the repair of non-functional pieces of equipment. Jamaica's partnership with Cuba was also integral to government's efforts to effectively staff the public health sector in 2012. Very early in the year, a technical cooperation agreement was signed with the Cuban government for that country to send 499 health professionals to Jamaica over 2 years. 19 specialist doctors arrived in May and were immediately deployed to health centers across the island. They were preceded by 45 Cuban nurses who arrived in April to support the biomedical disciplines in hospitals and health centers. At a health ministry retreat on January 13, Minister Fenton Ferguson announced that a Government of Jamaica GOJ health card would be introduced to allow persons with prescriptions from public health facilities easy access to medication at no cost. At the same time, several contracts were awarded to ensure a consistent supply of drugs at public health facilities. In March, Cabinet approved 28 supply contracts to buy 2 years' worth of 690 pharmaceutical items costing nearly $3 billion. Later in the year, the National Health Fund awarded 43 contracts to local and international suppliers for 2 years' supply of drugs to public health facilities.
This is a signal proof that we are committed to providing quality health care for the Jamaican people.
High on the agenda of the Health Ministry last year was a primary healthcare infrastructure renewal program to rehabilitate and retrofit health centers across the island. More than 80 health